Here we are. Hello. Thank you everyone for joining us for Mental Health Colorado's Legislative Lunch Break webinar series, where we share biweekly updates about what's happening at this Colorado State Capitol and how you can get involved. Today is February 13th, 2026. My name is Ashley Perales. I am the Senior Manager of Development and Operations with Mental Health Colorado and also your host. If you have any questions, the Q&A is open, and you can also email me for follow-up after the webinar at aperales@mentalhealthcolorado.org. With that, I will pass it along to Vincent and Wendy.
Thank you, Ashley. Good afternoon. Hi, I'm Vincent Atchity. I'm the President and CEO.
Good afternoon. I'm Wendy Buxton Andrade, and I'm the Vice President of Government Affairs. Thank you for joining us today.
So just a little bit of overview of how we do our work. Mental Health Colorado has been operating in the state since 1953, and we work to pass laws, change practices, and build a movement promoting healthier minds across the lifespan for all Coloradans. Each legislative session, we create a platform of bills representing our commitment to the focus areas that you see on the screen here across the lifespan, starting with a strong start for all children, uh, through the rest of life and wellness as we age, and addressing some of the perennial concerns that we have around ending health-based discrimination, decriminalizing health conditions, and reducing the potential harms of drugs and alcohol. Each year we produce a platform of bills, and our objective is to educate elected officials and voters uh, with regard to the complexity of our behavioral health landscape so that people understand that support for any single bill is highly valued in what we're after. But to be a true and consistent mental health champion, we're hoping for support across the whole range of our platform. So each week we're going to be highlighting bills that are of imminent concern for us, as well as bills that we've been watching and prioritizing across the length of the session. I want to start off by mentioning Senate Bill 60, which is about youth athletic coach mental health education. This is a Mental Health Colorado priority bill. Wendy, would you like to say a few words about this one? Oh, you're on mute. Okay.
I knew I was going to do that. This bill will be introduced in Health and Human Services Committee on the 1st of March is when we're expecting it. We're already doing some op-eds to help educate the public on what this bill does. It basically codifies in statute what is already happening in high school athletics. And the coaches take a mental health educational training, and it talks about what to spot in their athletes, as well as how their coaching can affect that athlete. This also has a tie-in to concussion protocols, and that after a concussion, that the parents or guardians just be notified that to watch their child for mental health condition. This is a pretty straightforward bill. It's already happening in Colorado. It has been passed in 7 other states. And what we're doing is putting it in statute so it lives on. As administrations change, so do priorities. And we want to make sure that youth mental health stays a priority for the state of Colorado.
Thank you. I'm excited about this bill. It's a bill that exemplifies the different kinds of advocacy that our organization does. We do, of course, this advocacy, bill-specific advocacy at the state capitol with regard to passing laws. But we also do the broader sort of advocacy, which is public education and trying to heighten people's awareness of the opportunities and risks for young athletes. And, young people's participation in athletic activities is a great opportunity to promote well-being on an individual level and the kind of well-being that comes from team play and good sportsmanship, and drawing our attention to that, as well as to red flags where we see uh, instances where things are not going quite as we would like them to go for our young athletes in terms of it not leading to well-being and exemplary sportsmanship. But we have a lot to learn and a lot to build on, as we've been seeing in our Olympians in the last week or so. There's such great models for well-being and sportsmanship. They're setting a great international example for what Americans can do at their best.
And as we always say, it takes a village to raise a child. So we want to make sure that that village has the best interest.
Thank you both. And as a quick note, we've added QR codes to each slide for the bills. If you open your camera and scan the QR code, you'll be directed to a platform where you can enter your address and be directly connected to your legislators and send an email in support of this bill. So we appreciate your advocacy on these bills.
Yeah, please do let your elected officials hear from you. Your voice really is very impactful in this context. All right. The next bill we're going to mention this week is House Bill 1024, which is raising the age of voluntary relinquishment of a child. As you may know, there exists in statute the ability to relinquish parental rights of a child at a safe haven setting, often at fire departments and other designated facilities, within 72 hours of birth. This bill simply changes that language from 72 hours to 30 days, which brings Colorado closer in alignment with other states that have similarly expanded that range of time. And it reflects a better understanding of the kinds of mental health conditions and other stressors that people can be experiencing in the days and weeks following childbirth. There's a little bit more margin for decision making. Wendy, please.
And this was heard this week on Tuesday in committee. It passed 13-0. There were a couple amendments just to make sure for protections of a mom afterwards through Human Services, and that will go through rule in Human Services. And this aligns Colorado with 34 other states have already passed the 30-day. Some are longer. Actually, Colorado was the shortest at 72 hours. And so this is very much a bill to protect our youngest, most vulnerable children.
And just to mention that unanimous bipartisan support, we are a nonpartisan organization and very much focus on bringing all of the divided sides together on issues that are focused on our common good, such as this one. And we like to see this kind of bipartisan support across all of the different bills that we're bringing to your attention.
On this bill too, just people, please talk about it in your communities, because we found out through the testimony this last week that a lot of people don't even realize that this is available to birthing parents. And, we want to make sure that a child, if they're relinquished, goes to a safe haven. And so that child can be cared for properly and not put in a dumpster or somewhere like that, because that is a human life that we want to make sure we protect.
Thank you. We want to bring to your attention House Bill 1064, Youthful Offender System Updates. This bill has emerged from our interim committee on behavioral health disorders in the criminal and juvenile justice systems. The objective of this bill is to ensure that young people who are justice involved are as well supported as possible in the course of their experience of justice involvement so that the odds of their successful reintegration into their communities and is improved, and the likelihood of their recidivism or re-engagement with the justice system as adults is decreased. Wendy, do you want to add something about this one?
Yes, this one was heard right after the Safe Haven bill this week in committee. Um, it did pass along party lines votes. It is something that is already being done in our youth offenders system, but they wanted to codify it in statute so it continues to live on. It also enhances uh, the healthy relationship building for teens. And because sometimes the trauma that they have gone through in youth has started coming out. And so this is very much a mental health bill and behavioral health wraparound services for our youth offenders. So they do not re-enter the system when they become adults, and we give them good tools and coping mechanisms.
Thank you, Wendy. So we're switching from our Strong Start for All Children category to often our broadest category in our platform, which is access to housing, healthcare supports and services across the lifespan. Senate Bill 31, use of prescription product with controlled substance. This is what is known as a trigger bill, which basically means that when a substance is approved by the FDA at the federal level for use, uh, it is its approval in Colorado is automatically triggered so that that substance becomes immediately available to folks whose health may benefit from access to it here within the state.
And this one passed on Thursday. It is headed to the Senate floor, and it was unanimous, and it looks like it will move safely all the way through the process.
Thank you. House Bill 1039, adding municipal jails to county jail oversight. We've categorized this as access to housing, healthcare supports and services, because basically what it does is stipulate that municipal jails within the state of Colorado become subject to the Colorado jail standards, the relatively newly formulated Colorado jail standards, so that the same standards of access to care and protective treatment are available consistently within municipal jail settings as well as within county jail settings.
And this is something that most jails are in county run areas, and this is adding in any municipal. The original bill, it's a cleanup bill. The original bill did not add in municipal jails. And so this is making all jails compliant to the same standards. And it is not yet scheduled for committee hearing, but we believe in everything being standardized, and this was just an oversight in the original bill, and so this is more of a cleanup bill.
Thank you. House Bill 1043, Transport Network Company Discriminatory Practices. This is an access to housing, healthcare supports and services bill because many Coloradans rely upon transport network companies to access care. And what this bill does is protect that access from health-based and other forms of discrimination so that drivers cannot decline to provide transportation for an individual seeking transportation based on their health needs.
This bill actually has a civil penalty. originally was set at $550. It goes up to $5,000 if a transport network company has discriminatory actions towards a rider and does not file that with the TNC reporting agency, and therefore making sure that we're protecting those that could be discriminated against. There are some provisions in here that allow for if somebody is violent towards a driver or something like that, they just have to report it to the agency, and making sure that that everybody can have access to transportation.
Moving along in the course of the lifespan towards our commitment to supporting wellness and aging, we want to bring House Bill 1110 to your attention, Vulnerable Adult Financial Exploitation Banking. One of the things that we do least well in this country is protect people as they age from all kinds of different instability and vulnerabilities. And one of those is financial exploitation. This bill puts protections in place to ensure that uh, aging adults who may be victims of financial exploitation have protective elements in place put in place by the banks and financial professionals they're interacting with, so that disbursements may be delayed and requests for disbursement may be investigated, so that we're not letting our aging folks become victims of fraud and exploitation.
And this committee hearing is not yet scheduled, but just to expand a little bit on it, it does allow that the banking, savings and loans, if they have reasonable belief that an elder is being financially exploited, they can put a 2-day delay and maybe check in with those around that individual to protect them from having that exploitation happen even further and financially devastating the elderly.
And then under the category of decriminalizing health conditions, Senate Bill 14, which is also a bill coming out of the Behavioral Health Disorders in the Criminal and Juvenile Justice Systems Interim Committee, is modifications to defense of not guilty by reason of insanity, or NGRI. And what this bill primarily does is clarify legal standards for conditional or unconditional release after commitment, so that there may be pathways to community placement of defendants who are determined to no longer pose a threat of harm to self or others and can be safely stepped down from the high acuity inpatient care to a community-based setting in which they can recuperate some of their civil liberties and reintegrate with their communities, and also open up capacity within the more high acuity setting for individuals who are awaiting access to that space.
And this did go through committee hearing at the Senate on February 4th. It has passed clear through third reading on the Senate floor. It is now over in House committees, and it has not been introduced in House committees, but it will be here soon. And Vincent explained it well, so I don't have anything to add on that one.
Thank you, Wendy. So just to bring to your attention, we just jumped through a couple of slides there, but I was just going to mention that our 32nd annual Legislative Education and Advocacy Day is coming up on March 4th. This is a free event all day long at the Capitol, where we welcome our co-advocates to join us in learning about some of the issues we're dealing with in improving our behavioral health landscape, and then spend some time in the Capitol building meeting with your elected officials so that they can hear from you and your interests. We strongly encourage you to join us, and you can use that QR code to register for the day. And then on March 19th is Colorado's Suicide Prevention Advocacy Day. Similarly, you can use the QR code to register for that. This is also takes place at the Capitol and is an important opportunity to let the officials know that we are there in solidarity for suicide prevention.
And just so you know, on Lead Day, we have had a lot of the senators as well as the House of Representatives reach out to us and open up their schedules to hopefully meet groups that want to come in and meet with them individually. So it's been a tremendous outpouring of support for Mental Health Colorado and our brainwavers and everybody else that wants to come to Lead.
Thank you, Vincent and Wendy, and sorry about the technical difficulty there. I'm back. We're back. Yes, Lead, we're almost full on reservations, so we're very excited about that and all the support we're getting for this event. So if you haven't registered yet, then use the QR code and we'd be happy to see you there. And if you haven't already, please join our Brainwave by scanning that QR code. You can receive legislative updates every week and then join us at the Capitol to testify on policies. We also have our 2026 legislation listed on our website. You can see the full list of bills and all the ongoing updates by following that QR code. And then if you follow us on social media, we share information on Facebook, Instagram, LinkedIn, and X, and we'd really appreciate you sharing that content to raise awareness about these issues. I don't see any questions in the chat. I do want to give a shout out to our sponsors, Rocky Mountain Health Plans and Accessotree, for supporting this webinar. And if you do have any follow-up questions after the webinar, just go ahead and email me at aparalis@healthcolorado.org. And that's it. Thank you all for joining.
Thank you, everyone. Have a great weekend.